that is infusion pressure. So this infusion pressure is dependent upon the source of the infusion, that is it is the bottle height, that which is gravity fed. Then we have zero or minimal wound leak. So there should be minimal wound leak, and this in turn depends upon the wound size and the leak through the side port. Then we should have a constant aspiration flow, so which is maintained with the help of pumps that have pinch rollers which aspirate fixed volume of fluid with each revolution. Now we'll discuss in depth about what are the inflow and the outflow components of phacoemulsification. So the inflow is the amount of fluid which is entering the eye, and it in turns depend upon, as we said, the bottle height and the diameter of the tubings. So inflow and the outflow, that is irrigation and aspiration tubings, pressure inside the bottles, that is the volume of the fluid in the bottle, and the resistance offered in the incision as well as the openings at the tubings. So if at all there is some lens matter which is left in the tube, it can offer resistance. Whereas the outflow depends upon the vacuum levels, aspiration flow rate, and wound leak. So we'll discuss about these components now in detail, and before going to that, we'll just have a note about the most commonly asked questions. So when should we increase or decrease the bottle height? So it is the irrigation dynamics. Now when should we raise the bottle height? So raising the bottle height is required when we need to deepen the AC, that is the anterior chamber. So it is required when the incision leak is more or the AC is becoming shallow. And then when we should lower the bottle height? So it should be lowered in case of PC rent and when we are performing vitrectomy, and also in case of high myopes who already have a deep AC. Right, so this was regarding irrigation dynamics, when should we raise and lower the bottle height. Then coming to aspiration dynamics. So aspiration decides the attractability or followability of the particles in the AC. So we have lens matter in the AC which has to come to the tip. So that is the attractability. So it is the ability of a fluid system to attract and hold the nuclear material or cortical material at the tip of the ultrasound or the irrigation or aspiration fluid. Okay, so this is attractability. So when the piece is not coming towards the phaco probe, we can call it as low followability. So in such case, we have to see what we have to do. So coming to what is aspiration flow rate. So this determines the time to reach the preset maximum vacuum levels. So the definition of aspiration flow rate is that aspiration flow rate is the amount of fluid drawn from the eye into the pump. So this determines the followability, and the rise time is the time taken to build vacuum after the phacotip is fully occluded. So AFR is proportional to pump speed, which is inversely proportional to rise time. Now vacuum is the suction force which is exerted on the fluid in the aspiration line, so which results in the holding capacity. So when we should increase the vacuum, so when we need to increase the holding power at the tip and also to reduce the power utilization, okay, the ultrasound power. And when we should lower the vacuum, when the chamber is unstable or the shallow AC is getting shallow, we have to reduce the vacuum. So vacuum determines holding power and AFR determines followability. So if you are new to my channel, please subscribe for such more informational videos.